A protruding pot belly in men, often termed as abdominal obesity, is a common health issue that can result from various factors. It is a condition characterized by excessive fat accumulation around the abdomen and is more than just a cosmetic issue. It poses significant health risks, and understanding why men are prone to developing pot bellies and learning effective strategies to prevent and manage this condition is crucial for promoting overall health and well-being. Men tend to store fat differently than women due to differences in hormones. While women commonly accumulate fat in their hips, thighs, and butts, men are more likely to store fat in the abdominal area. This type of fat distribution is influenced by testosterone and other androgens. The fat that accumulates in the abdominal cavity, known as visceral fat, surrounds internal organs and is more metabolically active than subcutaneous fat, which is fat stored under the skin. This makes it more prone to causing metabolic disturbances such as insulin resistance and inflammation, which contribute to the pot belly appearance. A diet high in calories, sugars, unhealthy fats, consumption of processed foods, sugary beverages, and alcohol are major contributors to the development of a pot belly. A sedentary lifestyle and poor sleep patterns also increase the risk of developing abdominal obesity. There are hormonal factors that can lead to an increased risk of abdominal obesity. As men age, testosterone levels naturally decline, which can lead to an increase in body fat and a decrease in muscle mass. Lower testosterone levels are associated with increased fat accumulation, particularly around the abdomen. Chronic stress also leads to elevated levels of cortisol, a hormone that promotes fat storage in the abdominal region. High cortisol levels are linked to increased appetite and cravings for high-calorie foods. Abdominal obesity is not just an aesthetic issue. It is associated with several serious health risks, including: number 1, cardiovascular disease. Visceral fat is a major risk factor for cardiovascular diseases, including hypertension, heart disease, and stroke. It contributes to the development of atherosclerosis, which is the hardening of the arteries, which can lead to heart attacks. Number 2, type 2 diabetes. Abdominal obesity is strongly linked to insulin resistance, a condition in which cells do not respond properly to insulin. This can lead to higher blood sugar levels and eventually type 2 diabetes. Number 3, metabolic syndrome. Metabolic syndrome is a cluster of conditions including high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. It significantly increases the risk of heart disease, stroke, and diabetes. Number 4, sleep apnea. Excess abdominal fat can lead to obstructive sleep apnea, a condition in which breathing repeatedly stops and starts during sleep. This can cause severe fatigue and increase the risk of cardiovascular problems. Number 5, cancer. Studies have shown a link between abdominal obesity and an increased risk of certain cancers, such as colorectal cancer and pancreatic cancer. The exact mechanisms are not fully understood, but are thought to involve chronic inflammation and hormonal imbalances. Now, what are some proven ways to get rid of abdominal obesity? Eat more protein, avoid very low-calorie diets or crash diets, avoid periods of starvation, as they can lower your metabolism and prevent you from losing weight. Add weight training to your routine and perform high-intensity interval training, as it is very effective in burning fat, including visceral fat. Find simple ways to manage your stress, either by walking or doing body weight exercises. Try to get good quality sleep. Drink enough water throughout the day, as this can aid in digestion, reduce bloating, and help control appetite. Reduce your intake of sugary and processed foods. Also, eliminate alcohol consumption from your diet when possible, as alcoholic beverages are high in calories and can contribute to weight gain, particularly around the abdomen.